Welcome back, everybody, for another deep dive. Today, we are going to be tackling healthcare in Chandigarh.
Okay.
And Chandigarh is interesting because it's both a union territory, AIING, a shared capital,
Right.
which makes for some really interesting dynamics when we look at how healthcare is provided.
Absolutely.
So Chandigarh, on the surface, boasts a really high per capita income and has some amazing hospitals.
Yes.
But when you dig a little deeper, you start to see some disparities
Right.
in terms of access and affordability.
Yes.
So our big question today that we're going to try to tackle is, can Chandigarh be a model for the future of healthcare in India?
Yeah.
Or is it more of a cautionary tale about inequality?
That's the paradox, isn't it?
Right.
And we're talking about a city that boasts top-tier medical institutions like PGMR.
Yes.
A hospital so renowned that it draws in patients from all over northern India, even Jammu and Kashmir.
Wow.
But then at the same time, you have 10% of the city's population living in urban slums with very limited healthcare access.
Yeah, that's a huge contrast.
A very stark contrast.
So you mentioned union territory.
Right.
And for those of us who are not super familiar with India's governance system, can you break down what that means?
Yeah.
And how that impacts Chandigarh's healthcare system?
Absolutely.
Hmm.
So essentially, as a union territory, Chandigarh is governed directly by the central government,
Okay.
unlike states which have more autonomy.
Gotcha.
Now, to make it a little trickier,
Yeah.
Chandigarh is also the shared capital of two states, Punjab and Haryana.
Okay.
So what does that mean? That means you have a huge influx of patients from those states seeking specialized care,
Yeah.
and they're all coming to Chandigarh,
Right.
which puts a significant strain on the city's healthcare resources.
Gotcha. Okay, so we've got PGIMR, this big player.
Right.
But what about the other hospitals? Give us the lay of the land.
All right, beyond PGMR, you have a few key public hospitals.
Okay.
You've got GMCH 32, which is a large multi-specialty hospital serving the city residents.
Okay.
Then there's GMSH 16. And what's interesting about this hospital is that it's designed to be affordable for lower income groups.
Okay.
And then we also have the ESIC Model Hospital, which caters specifically to insured workers under the Employees State Insurance Scheme.
Gotcha. So we've got all of these specialized hospitals.
Right.
But what about everyday healthcare needs?
Yeah.
What about the folks who can't easily travel to these big centers?
That's where primary and community health care centers come in.
Okay.
Your CHCs and your PHCs.
Okay.
These are absolutely essential for preventative care,
Okay.
maternal and child health services,
Right.
especially in areas that are further out from the city center.
Mm-hmm.
And then to go even further, you also have mobile health units that are actually going out there and trying to reach the most underserved communities.
Okay.
But even with all of these efforts, reaching those most vulnerable populations remains a challenge.
Yeah, it makes sense. So we've got this really unique local setup,
Right.
but then you bring in the central government's role in healthcare too.
Absolutely.
And it's not just about running PGIMR, right? They have nationwide programs like Ayushman Bharat that come into play here too.
Absolutely.
Yeah.
Ayushman Bharat, also known as PMJAI, aims to provide free health care to economically weaker sections.
Wow.
It's a massive undertaking.
Right.
It promises cashless treatment up to 5 lakh rupees per family per year.
Okay.
Just to give you some perspective, that's enough to cover major surgeries or prolonged illnesses,
Wow.
potentially saving families from financial ruin.
That sounds incredibly ambitious.
Yeah.
Is it actually working in Chandigarh?
Well, that's the million-dollar question.
Right.
In theory, it could be transformative,
Right.
reducing those out-of-pocket expenses that push so many families into poverty.
Yeah.
But like any large-scale program, it faces challenges with implementation and ensuring that everyone who needs it can actually access it.
Right. So we've got these huge initiatives, but it looks like Chandigarh isn't just focusing on hospitals.
No.
We've seen in our research that they have programs for urban and rural health outreach, schools, telemedicine,
Right.
even specialized programs for non-communicable diseases and mental health.
Absolutely.
They seem to be casting a pretty wide net.
They are. And one area I find particularly interesting is their approach to mental health.
Okay.
They're actually training primary care doctors to identify and manage common mental health issues.
That's interesting.
It's a clever way to increase access without needing specialized psychiatrists everywhere.
Right.
But of course, there's still a long way to go in addressing the stigma and the resource gaps in mental health care.
Okay, so it sounds like Chandigarh is doing a lot right,
Yeah,
but I'm sensing a but coming. There have to be challenges, right?
of course.
Even with all of these initiatives, there must be cracks in the system.
Let's be honest, even with all of its resources, Chandigarh still struggles with some of the same problems plaguing many healthcare systems in India.
Like what?
Well, for starters, overcrowded government hospitals.
Yeah.
It's a very common issue.
Yeah. The images of those packed waiting rooms are hard to ignore.
Absolutely.
It seems like PGImer and GMCH 32 are particularly swamped.
They are.
Why is that? We talked about PGImer's national reputation, but is there more to it than that?
It's a combination of factors. The influx of patients from Punjab and Haryana definitely plays a role.
Right.
But there's also a lack of sufficient secondary healthcare facilities.
Okay.
So cases that could be handled at a district-level hospital elsewhere often end up at these already overburdened institutions.
So it circles back to that unusual governance structure,
Yes, yes.
being a union territory but also a shared capital.
Right.
It creates this bottleneck effect.
It does.
And it's the patients who feel the impact most acutely.
Absolutely.
And let's not forget that amidst Chandigarh's affluence, you have people living in slums and migrant communities facing a very different reality.
A very different reality.
So it's not just about access to a hospital building.
No.
It's about whether they can even afford treatment.
Right.
Whether they even know about the services that are available.
Right. Exactly.
Uh-huh.
These are the questions that really expose the inequality embedded in the system.
Yeah.
Healthcare becomes a privilege, not a right for a significant portion of the population.
And even if you can afford it, there's still the issue of healthcare worker shortages in the public sector. This is a global issue, but is it particularly acute in Chandigarh?
It's definitely a pressing problem here. Salary discrepancies between the public and private sectors, heavy workloads, limited professional development opportunities. All of these factors contribute to doctors and nurses choosing private hospitals instead.
Okay, so we've got this perfect storm, overcrowded hospitals. Unequal access, and not enough healthcare workers.
Right.
Where does the private sector fit into this whole picture? Is it part of the solution or part of the problem?
Well, honestly, it's a bit of both. Chandigarh has a thriving private healthcare sector.
Okay.
With hospitals like Fortis Max and Ivy offering high-quality care and cutting-edge facilities. However, the higher costs create a two-tiered system.
Right.
Which exacerbates the inequality we've been talking about.
Yeah, so it's a complex situation.
Very complex.
No easy answers. But before we get too overwhelmed, let's take a step back. We've laid out the challenges, but our sources also point to some potential solutions.
They do.
Okay, let's dig into those.
Sounds good.
What's on the table?
Well, one idea that comes up repeatedly is public-private partnerships.
Okay, now, that's a phrase that gets thrown around a lot.
It does.
But what would that actually look like in Chandigarh's context?
Yeah.
How could those partnerships actually bridge the gaps that we've been discussing?
Well, there are a number of models to consider.
Okay.
For example, private hospitals could be incentivized to offer more affordable services through schemes like Ayushman Bharat.
Okay.
Or they could even be encouraged to set up clinics in underserved areas, taking some of the pressure off of those tertiary hospitals.
So bringing that private sector efficiency and resources to those underserved communities.
Exactly.
But with safeguards in place to make sure that it's affordable.
Absolutely. That's key.
That seems like a good starting point, but what about tackling that healthcare worker shortage?
Yeah, that's a tough one. But public-private partnerships could play a role there, too.
Okay. How so?
Well, think about things like collaborative training programs.
Okay.
Knowledge-sharing initiatives. Even joint recruitment drives.
Interesting.
It's about finding ways to bridge the gap between the two sectors, drawing on their respective strengths.
Okay, so we've got some potential solutions on the table.
We do.
But it's clear that Chandigarh is at a crossroads.
Yeah.
It has the potential to be a healthcare leader.
Absolutely.
But it's facing these deeply entrenched challenges. This raises a critical question for us. Can Chandigarh truly serve as a model for the rest of India? Can it actually demonstrate how to build a robust and equitable healthcare system? Or will it just become another cautionary tale, highlighting the pitfalls of inequality and the struggles of managing this complex healthcare landscape?
That's what we need to figure out.
We've got a lot to unpack there, but before we dive into all of the potential solutions and policy recommendations, let's take a quick pause.
Okay.
When we come back, we'll explore what the future of healthcare could look like in Chandigarh and what lessons it holds for the rest of India.
Sounds good. Okay, so we've painted kind of a complex picture here of Chandigarh's healthcare. It's a mix of these impressive resources, ambitious initiatives, and then some very real challenges. But let's try to shift gears a little bit now. And talk about what the future could hold. Our sources actually offer some really concrete recommendations.
Okay.
Kind of a potential roadmap for addressing these issues.
All right, lay it on me. What needs to happen to make Chandigarh a true healthcare model?
Well, one key recommendation is the need to develop more robust secondary healthcare centers.
Okay.
It's about strategically distributing those resources, easing the burden on PGMer.
Okay.
And allowing it to truly excel as a tertiary care and research institution.
So instead of every single complicated case ending up at PGMer,
right,
you're creating more options at a district level.
Exactly.
And you're handling those more routine procedures closer to where people live.
Right.
Does that also help with that bottleneck issue we talked about?
Absolutely. It's about creating a more tiered and efficient system.
Okay.
So PGMer can really focus on those cases that need its unique expertise.
Gotcha. Another critical area that our sources point to is strengthening mental health infrastructure at the primary healthcare level.
Yes, this is so important.
I'm really intrigued by this idea. We touched on it a little bit earlier.
Right.
But I want to understand this more. How does that integration actually work?
Yeah.
Are we talking about having psychiatrists in every single PHC?
Not necessarily. A more practical approach is training primary care doctors.
Okay.
To identify and manage common mental health issues.
Okay.
This makes mental health care much more accessible,
right,
reduces stigma, and allows for early intervention.
That's huge.
Imagine someone who's struggling with anxiety or depression, being able to seek help from their family doctor,
right,
someone they already know and trust.
Yeah.
It could be a real game changer.
That's a brilliant idea. It makes so much sense, especially given the shortage of mental health specialists.
Exactly.
But building on that, what about those critical moments when time is really of the essence?
Right.
Our sources also highlight the need for improved emergency medical services.
This is absolutely crucial.
Okay.
Especially for a city like Chandigarh.
Yeah.
With such heavy traffic flow, both within the city and from neighboring states.
Right.
We need to make sure that the system is equipped to handle emergencies effectively.
Okay.
And swiftly.
So better ambulance networks.
Yes.
More trained paramedics,
right,
streamlined protocols for handling everything from accidents to heart attacks.
Absolutely.
Yeah.
But it's not just about traditional approaches.
Okay.
Technology is also playing an increasingly crucial role in healthcare.
Yeah, that's true. Do the recommendations touch on that at all?
Absolutely. Our sources emphasize the need for embracing AI and digital health innovations.
Interesting. What does that look like?
Well, think about things like faster diagnostics, more efficient consultation processes.
Okay.
Maybe even remote monitoring of patients.
The AI piece really fascinates me.
Yeah, it has a ton of potential.
What would that actually look like in Chandigarh?
Well, imagine AI assisting in analyzing medical images.
Okay.
Potentially speeding up diagnosis and treatment.
Wow.
Or predicting disease outbreaks.
Okay.
Helping to allocate resources proactively.
Right.
We could even see personalized treatment plans.
Wow.
Based on an individual's genetic makeup and lifestyle.
That's amazing.
And of course, telemedicine is another game changer. Extending the reach of specialists to those rural and underserved areas.
Right. Okay, so we've got these really specific recommendations.
Yeah.
Bolstering that secondary health care. Yeah. Integrating those mental health services,
right,
strengthening emergency response,
yes,
and harnessing technology.
It's a good plan.
It is, but here's the question that keeps nagging at me.
What's that?
Can any of this truly address the deep-rooted inequalities in Chandigarh's healthcare system?
That's the challenge, isn't it?
Yeah.
These recommendations, while excellent, need to be implemented with a laser focus on equity.
Right.
Building new hospitals and introducing fancy technology won't solve anything.
Right.
If those resources aren't accessible to everyone.
So how do we ensure that these solutions don't just benefit those who are already privileged?
Yeah.
How do we make sure that those living in slums and migrant communities aren't left behind?
It requires a multi-pronged approach. First, we need to ensure that those new facilities and services are geographically and financially accessible to all,
right,
regardless of their location or income.
Okay.
And second, we need to tackle those social determinants of health.
What does that mean?
Well, things like poverty,
okay,
lack of education, inadequate housing.
Yeah.
All of these things contribute to health disparities.
Right.
And addressing those root causes is just as important as building hospitals.
Right.
It's about acknowledging that health isn't just about medical care.
Right.
It's about creating an environment where everyone can thrive.
So coming back to our central question.
Yeah.
Can Chandigarh truly be a model for India?
Right.
Or is it destined to be a cautionary tale?
Yeah.
Have we gotten any closer to an answer?
I think the answer lies somewhere in between.
Okay.
Chandigarh has tremendous potential,
Right.
but it's at a crossroads. The choices it makes in the coming years will really determine its trajectory if it prioritizes equitable access and addresses those social determinants of health.
Okay.
Then yes, it absolutely can be a shining example for other cities and even for the world.
Wow.
But if it falls into the trap of simply replicating existing inequalities with just a technological sheen, then it becomes a cautionary tale, a missed opportunity.
That's such a critical point. Even with all of its resources, Chandigarh is facing those same fundamental questions about healthcare as the rest of India.
They are.
How do we balance cutting-edge advancements with equitable access?
Right.
How do we ensure that the benefits of progress reach everyone?
It's a tough question.
It is, and that's where this deep dive gets really interesting.
Yeah.
Chandigarh's story, while unique in its context, reflects a much larger global struggle.
Absolutely.
It's a microcosm of the challenges and opportunities facing healthcare systems worldwide.
It is.
And it makes you realize that this isn't just about Chandigarh.
No.
It's about the future of healthcare itself. And that brings me to a question for our listeners.
Okay.
If Chandigarh, with all of its advantages, is grappling with these issues, what does that mean for your own community?
What are the unique challenges, opportunities in your own backyard?
It's easy to get overwhelmed by the sheer scale of all of these healthcare challenges.
Right.
Not just in Chandigarh, but globally.
Absolutely.
It feels like such a massive system. Where do you even begin to make a difference?
Well, I think it's important to remember that change often starts small.
Okay.
Right, in our own communities.
Okay.
Chandigarh might be our case study today.
Right.
But many of the issues we've discussed resonate across India and beyond.
That's true.
That means there are opportunities for action everywhere.
So for our listeners who are tuning in from all corners of the country and maybe even beyond India, what can they actually do?
Yeah.
What does that local action look like?
Well, step one is always education.
Okay.
Take some time to understand the healthcare landscape in your own community. What are the strengths? Where are the gaps? What are the unique needs of those who are often marginalized or overlooked?
Okay, so knowledge is power.
Right.
But once you've done that homework, what's next?
Right.
How do you actually translate that understanding into action?
Well, the beautiful thing is there are so many different avenues for engagement.
Okay.
Maybe you volunteer at a local clinic or support a community health initiative.
Right.
Perhaps you have a knack for policy and can advocate for change at the municipal or state level.
Sometimes it feels like those systems are so big and impenetrable.
They can be.
But you're saying that even those small actions can have a ripple effect.
Absolutely. Never underestimate the power of conversation.
Okay.
Raising awareness among your friends and your family.
Right.
Sharing what you've learned. That's planting seeds. And for those with specific expertise or passions related to healthcare, there are countless organizations out there doing incredible work on the ground. They need volunteers, they need advocates, they need fresh perspectives.
So it's about finding your niche.
Exactly.
Your way of plugging into that larger ecosystem.
Right.
But what about those of us who aren't healthcare professionals?
Yeah.
I'm a podcast host.
Yeah.
I'm not a doctor. What can I offer?
You're doing it right now.
Okay.
Using your platform to spark these conversations, to make these complex topics accessible and engaging. That's incredibly valuable.
I appreciate that.
You're helping people understand the issues, connect with those human stories, and hopefully feel empowered to act.
Yeah, I love that.
Yeah.
So as we wrap up this deep dive into Chandigarh's healthcare system, I'm walking away with kind of a mix of emotions.
Yeah.
There's a sense of urgency, but also a glimmer of hope.
Yeah.
It feels like even amidst all of these challenges, there's a growing awareness.
Right.
A willingness to kind of push for a better future.
That's what I find so encouraging. Chandigarh's story is a reminder that healthcare isn't just about hospitals and technology.
Right.
It's about people.
Yeah. It's about equity.
Absolutely.
It's about ensuring that everyone has the opportunity to live a healthy and fulfilling life.
Yeah.
And that's a mission that needs all of us.
Yeah.
Wherever we are, whatever our skills.
Well said. To our listeners, we hope this deep dive has sparked your curiosity, challenged some of your assumptions, and maybe even inspired you to take action.
Right.
Whether it's learning more about your local healthcare landscape,
Yeah.
supporting an organization doing great work,
Right.
or just simply starting a conversation with your friends and family. remember every step counts.
Absolutely. The conversation doesn't end here. Keep exploring, keep asking questions, and keep pushing for a healthier and more equitable world for everyone.
Thank you so much for joining us on this deep dive. We'll catch you next time.